computer. Okay, so welcome to this session for verification of death, and this is for expected death. So when we're nursing somebody who we know is going to die, there's a process now that we can do with clinicians, so doctors, and they're doing remote clinical certificates to confirm people's passing. So a couple of housekeeping rules. If we can turn phones off, I'll do the register based on participants. That's fine. We don't need to worry about that. If there is a fire in any of your locations, do your normal stuff, because obviously just log off and I'll accept that. Any first aid incidences, again, just log off and just let me know afterwards. If we can respect each other's points of view throughout the session, we are talking about an emotive subject. So death brings on very different feelings for different people and based on different beliefs and values. If you've got any questions, by all means, please ask as we go along, or if you want to hold at the end, that's fine. Breaks, I'll do a break about an hour in. It'll only be a 10-minute one just to get some water and a wee break because we know wee breaks and water is important. If we can have fun on this topic, let's try, but obviously if it's appropriate, and then I want you all to participate. So you're going to need to be able to answer in the chat function, or at least tell me an answer when I ask you. So the aim of today, we've got 4 outcomes. 1, we need to understand information for individual employers and personal assistants. So that's the roles and responsibilities of verifying death. 2, we need to consider the plan and to prepare for the verification of death. 3, we need to know what happens during the verification for death. And 4, we have the aftermath for the verification of death. And then there's some further references for your reading so you understand a bit of the wider context. Obviously, a little disclaimer. Just be sensible with this. The information is right at the time of it being produced. It's come from reliable sources. So again, as evidence-based practitioners, and you must make sure if you carry out any verification of death that you're aware of what they are. Health and safety policies, again, within your own work environment. So if you're a PA, personal assistant, so like Kat and Anne and all that lot, you fall under PA routes. Karina, you're obviously under your own home. So you have different policies and procedures just to follow. Equally, with respect to equality and diversity, obviously it's quite a complex subject, and it's about us talking about our values and our belief systems, but also recognising others. And where death comes into this, actually, it's really important because we have our own belief and we want our own death to look a certain way. So it's important that we're able to appreciate that and understand those. And finally, and you've heard me say this before, follow policy and procedure all the time, but make sure you read your company's policies and procedures and you review them, because it is clear from when I'm going out doing the observations and the face-to-face things, some of the policies and procedures I've read are a bit ropey, some of them aren't even there, and some of them I'm not sure where they actually came from. So it's important that at level 5, you're able to read that policy and understand it and apply it back to practice. That's the important bit. At the end of the session, you'll be given an e-form to fill in. That's just for feedback from today. So finally then, before we get into the subject, recap on last session. And this is kind of where most of you should be now. And that's working towards the RPL workbook, preparing that essay. Most of you have had your observations and then the professional discussion. So they're your 4 key pieces of work. And if you're not sure where you should be at that, then obviously please reach out to me after this session and we'll have a chat. But it's those 4 pieces. So by now, you should all be thinking of your research project. If you can't think of a research project, this subject will make an excellent research project, because verification of death, there are lots of different ways of it being done at the moment. So it's actually a really useful research project. If you haven't got one, you could use this as a starting point for it. In your main diploma, you have 6 key themes. One is the principles and philosophies of healthcare. So that's understanding the our system of healthcare, which I have to say, I think is getting more complicated as we go on through the years. And I'm facing more barriers as a frontline clinician now than what I actually anticipated to be there. So principles and philosophies of healthcare is basically understanding the workings. Which department do we refer you to? Why is that department there? Why do we even do this? So what's health, what's well-being? So that's the thinking of healthcare. Theme 2 is working with others. So this topic obviously relates to that because you need to call a GP and you do the death verification over the phone with the GP. So that links quite well with that. Theme 3 is personal-centered outcomes. So if we're going to work with people and we know they're in the dying stages, they should have an end-of-life care plan, and therefore it is going to be personal-centered. And a lot of the stuff around personal-centered care planning with death verification looks at the speed in which we need to handle the person to move them to their aftercare because of religious beliefs and values. Safe ways of working. Nobody wants to send a body to the undertakers that's still alive. I think it has to be the number one fear of a clinician, and it has to be probably the number one fear of people waking up dead. So we are definitely going to run through death verification and safe ways of working, because I do not want it on my pin that any of you have diagnosed somebody who is deceased and they wake up. That has to be my ultimate fear for you lot as well. Clinical activity. So death verification is a clinical activity which all people can take part in. It's not exclusive to anyone, so everyone can do death verification. And then personal development, obviously after this course, you should be able to verify death and you should know how to maintain your own CPD. So holistically, this course covers all of your main aim of the diploma. Within the standard, so this is the apprenticeship part, it will meet all the values and all the behaviours, because I would expect you to be acting in an honest and polite, integral way. For knowledge, you'll need to have a basic understanding of the organisation of the human body, because you need to take the pulse, you need to check the respiration, you need to do the heart scan. So again, there should be some basics there. Lifespan development, because it is part of lifespan development death, so understanding that last part. We're going to be looking obviously at the holistic approach to person-centered care, and you've already done this, so this is just that last part. And then finally, the importance of evidence-based practice. So at the end of this presentation, you'll see the slides with all the links, and there's some further recommended reading there. Skills, so this is what you should be able to do by the end of this. You should be able to work within your own scope of practice. You should be able to case manage. You should be able to carry out the assessment for death verification. You should be able to communicate clearly to the family and to others. You should be able to work in a personal-centered way. You should be able to carry out the physiological measurements, but I know all of you can do that anyway, because I've been out and observed you doing vital signs. Risk management is yours, so that's health and safety, infection control. So how we care for a body that may be infectious, so for example, COVID-19, looking at then equality and diversity, and finally looking at quality assurance, so writing up those notes and passing those that piece onwards. So they're the skills. Because you're doing an apprenticeship, English and maths is important as well. So throughout this, you should have a basic understanding of physiological measurements. That's basic maths, counting, mean, median, modes, all that stuff will do. You should be able to read, because obviously that's a care plan, and you should be able to write your care plan. So that's the level of English and maths. And you should be able to communicate clearly, and that's again SABAR, situation assessment, background, and recommendations. Other points to consider, because you're on an apprenticeship, we have the British values. So within this, it ties to the rule of law, because again, death verification comes under the COVID Act. It was altered in 2020 to do this. Mutual respect, obviously tolerance. Prevent, as we go through this and we talk about death, we're thinking about what's acceptable as a term. So if people start to have quite extreme views about death, that could fall under the prevent strategy. Safeguarding as learners. So this is your mental health and your well-being, because death verification could be quite it's difficult to begin with. Your own health and safety, so that's your roles and responsibilities in infection control. And finally, understanding different faiths when dealing with the equality part. So there are the points to consider. Because you're on a level 5, we also want to look at the stretching challenge. So this is about going beyond today's session. So after today's session, you can review your own policies and procedures, develop your own flow charts within your own services. So if you did have a sudden death, what are the steps that you're going to take? Because there's no point panicking once the horse is bolted. You want a clear flow chart about how you're going to manage death within your own service. You should carry out independent research on different types of deaths and settings. And this is this bit where I said, if you haven't done your essay project, this would make a really good essay project. Looking at different deaths in different settings could be a really interesting thing to look at. The review of your deaths and dying process, so in each of your services, review that, and have a read and review the end-of-life care plan. So when you read people's care plans, do you know, if you're going to verify that death, do you know what you're going to do? So the steps that you're going to take for the aftercare of the body. Equally, I want you to start talking about death at work. Have much more open discussions with people about it. Let's make it a less of a taboo subject and a much more fluid conversation so people aren't afraid of it. Finally, support others to understand the concept of the good death, and you'll do that in your death and dying modules online. And I think most of you have done that anyway, so that's great. And then equally, part of your functional skills is to do a speaking and listening challenge, 15-minute presentation. So again, here you could do a small presentation about death verification and explain this to the people that you work with. So care assistants can now verify death. So it's in the title, really, verification of death when it is expected. So as long as we know that death is expected, then we can do now clinical remote support to sign off that death and to help that process. So before we start, why do you think it would be a benefit to carry out death verification within your service? So if you want to take your microphones off mute, and if you just want to have a discussion about the benefits of carrying out death verifications within your service.
So I guess the benefit is that you're not having to obviously wait on the doctor to obviously come out, and especially during COVID, it's been particularly bad because obviously a lot of the doctors aren't attending. So actually, I found that if we had this death verification ability, then it would have taken an awful lot of strain off like loved ones kind of having to wait such a long time to get that verification.
Okay, thank you. Anyone else? What about in the care home, Karina? How long does it take for the GP to come out and do a death verification?
Well, I don't know how long exactly, but they coming quite straight away as soon as they can.
So as soon as they can?
Yeah, usually they coming district nurses, and even if it's middle in the night, they will come out.
So it sounds like you've got a reasonably good service where you are, because
I guess
that's not typical across the country.
Yeah, I guess because
we had someone passed away middle in the night, and they came, and in the morning was gone.
Right, okay, that's reasonably quick. Yeah.
Yeah. I mean, I guess the difference in the care setting as well, because obviously with domiciliary care, and especially based in London, obviously the services are under an awful lot of pressure. I don't know where your one is based, but certainly domiciliary, I guess, because they've actually got to get to certain homes and actually get out into the community. I guess.
Okay,
the person.
That's really good. Let's flip the question then. Imagine you're a relative and your mum or dad or your loved one has passed away. what would it mean to you as the relative to have that verification quickly? What does it do for you, do you think?
Kat, have you got any comment?
No, probably just peace of mind, really.
Yeah, absolutely. So it's about that peace of mind, isn't it? Because there's always that hope that people are clinging on to, isn't it? They're not dead. Maybe, you know, maybe this isn't real, and it slows everything down. So that quick verification, you can manage things a little bit more quickly. Think about now the aftercare of the body. Why is it important to do quick verification for the aftercare of the body? What happens to the body?
Yeah, well, I think if we can get it pre-rigor mortis, it would be handy.
Yeah,
obviously it makes moving things an awful lot easier.
Yeah, so a couple of stories I've got here on this one. There was one gentleman during COVID that I asked another colleague of mine to help deal with the death. So he died in his home. He was known. The paramedics had gone out. They said, look, he's going to die soon. We just don't know when. He then passed away 2 hours later. And the home obviously called the ambulance service to come back out and do the death verification. And they said, look, we're not going to be back out for 8 hours. We're just too busy. The doctors wouldn't come out because obviously they're working from home or they're remote working. So then that was another problem. And obviously, before you can move a body and stuff, you need to make sure that you've done an assessment. So the dignity of the person as well, as Andy rightly said, to have them in a position to do death verification and to kind of do that aftercare bit of the body is really important, because nobody wants somebody where they've set, you know, that rigor mortis is set and the body is in a terrible way. So that dignity of the body is really important as well. So for me, this seems a no-brainer that we've gone that one step further now and said, look, carers can do death verification with the others are just joining, with the support of others in the room. And the benefits of doing early death verification, then we've seen it's better for the service users in the dignity of the body in their aftercare. It's better for the family members because you've got that closure, you haven't got that waiting around. And for then us, it means we can prepare people in a much more dignified way. So death verification, I think, is a really useful skill for you guys to have. So just a quick one, and I apologise that it's a bit deathy by PowerPoint today. But anyway, this training is for adult social care providers and registered managers to understand the steps they need to take and what they need to have in place in order to verify a person's expected death remotely or to support staff to do so. The training is based on the British Medical Association, so that's up in Tavistock Square in London, the guidance and government's guidance from Hospice UK. So this training has been co-produced by lots of evidence base and lots of practitioners. It's designed to support providers and registered managers to make decisions within their local systems and if or how they will organise and prepare themselves and the workforce to verify expected deaths with support, remote support. So when we look at this, that's the introduction to why we're going to be doing this. And it's important, there's some key important parts in this. It is to work within your local systems. So you need to have a chat with your GPs, your social care system. Is death verification, is remote death verification something that they're doing? And if they are doing it, great. But if they're not doing it, you can guide them to this, because it is a national strategy for care homes to be able to do death verification for all of the reasons we just spoke about. Welcome to everyone that's joined. The session is recorded, so please just play back to the bit where you've joined us on the team. And if we can just pop our cameras on mute, everyone, that would be amazing. Thank you. So this includes, you need to think about beforehand to make informed decisions about verifying expected deaths with clients, with remote support, and who is involved. So for example, is it in the care plan? Is it something that everyone's agreed to? And who is it that's going to be doing that death verification? Information to support decision makers wherever the care workers will verify the person's death with remote support. So in other words, making sure you've all had the right training, you've got the right documentation, and I'll show you the documentation shortly. That again, we spoke of that flow chart. Do you know the steps in which you're going to make? And again, you want this to be seamless, because if family members kind of see you flapping around and you're not being confident or sure about what you're doing, that's going to make them very nervous that you're verifying somebody's death. So these are all discussions, and all of this needs to be done before you go down this process. You need to make sure that the process of verifying an expected death with remote support. So again, talk to the GPs, just say, look, if somebody passes, can we do a remote support? Because for them, you're saving them coming out and you're saving ambulances coming out. So the money in which you are saving the National Health Service will be great. I mean, at the end of the day, once somebody has died, is it an emergency? What do we think? No. But we do want them to be treated quickly, with respect, and in a dignified manner. And we know the sooner you verify that death, the sooner you can prepare the body and obviously it being ready for its journey to the undertakers. And finally, what to consider after the process. So that's the care of the deceased, the family and the staff. So when we verify death, we're going to look after the body first. We then sort out the family second, and then we sort out the staff third. So we must make sure that in any death verification, all of those involved receive aftercare and good supervision. So again, it's useful for you to have some information ready to give people when this comes around. So information for individual employees and personal assistants. So this training is designed primarily for social care workers working in residential or nursing homes. And obviously in domiciliary, sometimes people employ people as PAs, and that's what this bit relates to. And it just basically says, whilst the training still remains the same, you've just got to realise that in emergency times, end of life care and advanced care planning are rare occasions. But again, you need to make sure that you've had those discussions and arrangements are in place and that people are aware. Because if you are a PA, you would normally be preparing all of that end-of-life care part, when actually in a nursing home or residential home, there's teams of people that manage all of this. So be mindful that if you are in that position, you need to think about that. So let's look at the very first learning outcome. So this is things to consider to plan and prepare. So verification of expected death is carried out to confirm and record that a person has died. This is usually done by a clinical healthcare professional, such as a doctor, nurse, paramedics, as part of their job and in line with their professional code of conduct. The certification of death identifies the cause of death and is carried out by a medically qualified doctor. So that's the normal process. However, the Coronavirus Act in 2020 and recent government guidance here on COVID-19, verifying death in times of emergency makes special arrangements for verifying an expected death with clinical remote support. In a community setting such as care homes, supported living, accommodation, and where a person receives care in their own home. So again, that meets that PA bit and domiciliary. Remote supported verification by a care worker where death is expected can prevent delays and cause distress for the bereaved relatives and others. So again, it's maintaining their dignity as well as enabling the funeral arrangements, spiritual and faith practices in a timely manner. So this is reasonably new as it's coming out. I don't think this came out as quick as it could have, because only now people are really getting their heads around it. So this training does not replace existing practices for verifying a death in the community, and you must operate within your organisation's guidance with support from your manager. Where local systems are in place and working together to verify a death in the community, these arrangements should be continued. So, for example, if you already have really robust processes, that's fine, but it doesn't stop you having these conversations with the doctors, with social care workers about you guys doing the verification for early release of the body. Again, the training is provided for a period of crisis, and it might be more difficult for doctors and clinicians to attend in person. And I know we've all experienced that over the last couple of years. And equally, I think this winter, they're obviously talking about us coming into the 5th wave of COVID. So we don't know that in winter, we're not going to be back in the same situation where the resources are going to be limited. And equally, we know, don't we, in the care homes, that December, January and February is normally the silly season for people dying. We normally know in those periods of time, there's quite a lot of death, isn't there? So equally, us having this training, being able to do a death verification can save time. Okay. So, and I'll email these all out. This will all be on the dashboard, by the way, when we finish. I'll upload the video so you can download the PowerPoints, and I've got 2 guides that come alongside this, so you've got this all in writing. So the first thing to consider for you all when undertaking death verification is, the first thing is, does your local authority or healthcare system and GP practices support remote support for death verification? So you just need to ask them. You can say that you've done your training. Is that something that they're doing? They may not know about it. So the reason I'm going to give you the access to the legislation and the documents is so you can, again, pass this information on to the relevant people, because it does seem from me going out to all your homes, some of your local authorities let you do stuff, some of your local authorities don't let you do anything. So having the right evidence to support that is obviously really important. Obviously, this is the training, so you'll have done the training and you can say that you've attended, and I'll sort out certificates for this particular course for you all. So again, you'll have that within your homes as well. So the second thing to consider is, does your organisation allow you to do death verification? So you need to go back to your policies and procedures and ask, can we do this? Now, like we said, this training is designed for care workers to verify death. And I guarantee all of your policies at the moment will go, only a registered clinician can do it. And that's because the law prior to this said that. Now, under the COVID law, the 2020 piece of legislation, it states other people can verify death. So you need to go back to your services and say, look, I've done the training, I've got the paperwork, I've got the policy. Is this something we can do to help that aftercare bit? What are the implications for your organisation? So in other words, have you got enough people to do it? Does everybody have training? So ultimately, on each shift, you would need somebody that could verify a death. So that's just thinking about you in your homes and in your services. If you say to the local authorities, look, we're more than capable of doing death verification. Remember, it's a bit like first aid. You're going to need an appointed person on every shift to do that death verification. Or at least your managers or seniors should be able to do that. Would this approach fit your organisation's end-of-life practices? So a lot of you will be doing the gold standards framework. You'll have all done your end-of-life care. And am I right? You can all shout out yes. Am I right that you've all done end-of-life care training now? You should be saying yes, because it's in the Canvas app anyway. But have you done it within your services?
Is there any expiration for end-of-life training? I've done it. No, I've done it.
Yeah. Yeah, ultimately, it's not one of those things that expire every 3 years.
Yeah.
you know, however, holistically, we know it's a lot of skills, isn't it, that you have to keep doing, you know, updating the care plans, person-centered bits, and all of that lot. So, and this really, death verification is the final part of end-of-life care, isn't it? It's the last thing you can do for somebody. So does this fit? And actually, it's quite a nice thing, isn't it, for you to carry that last act out for somebody. Which staff would do this task? My view, anyone on an NVQ level 3 and above is more than capable of doing death verification, because again, it's under the supervision of a clinician. You're just following what the clinician says. And I would say most of your staff, and correct me if I'm wrong, but most of your staff are able to wash somebody, prepare the rooms and stuff like that for death. Yeah. So if you're preparing the room for somebody, you're used to working around a deceased person. Have you all looked after or managed a deceased person? Have you all managed to look after somebody who has died? Have you all seen a dead person? Let's start.
Yes.
Yeah, all seen a dead person? Some nods?
Yeah.
Perfect. Okay, so this isn't what we're covering here then isn't going to be a shock for anybody, but it's about that just making sure that if you're supervising junior people for the first time, it could be quite hard, can't it, to manage death. Equally, volunteers, if you have volunteers, that's fine. Then you need to think about your record keeping. So for the record keeping, for doing a death verification, you can do that in the patient's notes, but I have got a template form that if you do a death verification, you can fill out a piece of paperwork. Everybody loves a form. There's no need for a form, but if you do have a form, then at least that way people feel you've done something. So I'll show you that form. It's on one of the NHS trusts things. Then finally, have you clarified the process and agreed this? So for example, if you do remote death verification, how are you going to do this? So with your GPs, have you got a remote link? So when your doctors do their ward rounds, do they do that via remote link, or would they, you know, how would you do that? So just think about that. So again, that's done. And obviously, if you do death verification via a remote link, make sure the link works, because we don't want a delay in the body being verified. So there are a number of questions as well that you need to carry on asking. So again, for information about the use of digital and social care on the go, there's a website there that you can have a look at, and you'll need to think about how you will ensure the well-being and management and the support and supervision of those who agree. So that's the aftercare for the staff. So if a member of staff has done death verification, what supervision and support have they got? And I assume that you all have supervision. Am I right?
Yeah.
Yeah. And if you have a sudden unexpected death, or if you have an incident at work, you can have another supervision. Is that right? Good. You need to think about good practice. So again, moral support for each staff. You need to think about how you'll carry out the necessary risk management plans, making sure you have all the stuff that you need. And then you need to make sure that you've got the advanced care plans in place. So for example, if somebody is a DNACPR, so they do not resuscitate, attempt to resuscitate, at what point do you then do the death verification? Okay, so just having that process in place. And then the final bit really is to make sure that you have clear end-of-life policies and procedures when somebody dies. So let's talk about when you can do this. So you need to know the difference between an expected death and an unexpected death. Unexpected death follows when you've got a general deterioration of a person's health following a long illness. So under the Coronavirus Act 2020, the term also covers deaths due to COVID-19, okay? Because again, it's not a long-term thing, it's COVID-19. So they added this into the policy. And it means the person must have been seen by a registered medical practitioner within the last 28 days. Okay. So it's important that you know that if you do death verification, that they have been seen in the last 28 days. Okay, so that's one of the things. So if you are doing that, make sure you keep on top of it. Unexpected or sudden death. So this is a person did not need end-of-life care and has not been terminally ill. In these circumstances, the GP will lead the process and the coroner will be notified. Okay, so that's when it's unexpected. You know, it just happened. That's when it gets a bit worse. And the sudden death becomes a suspicious death, and that's if a crime or an accident is suspected, then you contact the police. Okay, so hopefully you've got all of that in your policies anyway. So you've got 3 types of death: the death that we know about, the unexpected death, and then a suspicious death. Okay, so they're your first 3 things that you need to understand. So when can a care worker verify a death? So you can verify a death when the death was expected. So if they've been seen in the last 28 days, we know they're going to die, you can then carry out that death verification. There needs to be an arrangement with organisations and local systems. So you need that agreement with the doctors so you can do this remotely. And the care worker is deemed competent to verify the death. So in other words, you've had this training and we've signed you off on your OSCE. And then finally, that there should be remote support from a registered medical professional. So again, that could be Macmillan's, that could be community district nurses, or indeed that could be the doctor. So when to recognise or verify death. So if you do not feel confident or competent to verify the death, remember no one should feel pressured to verify death. If you have any doubts or concerns, you wouldn't verify the death. If the death is notifiable to the coroner's office, so for example, it was a suspicious death. If the person has not been seen by a healthcare professional in the last 28 days, then you would need to do that, or 14 days during COVID-19 pandemic. So if we do hit another 5th wave, that date and time could change. If the death is unexpected, if the death is sudden, anything about the death just seems suspicious. So again, safeguarding the situation or criminal activity. Okay, so they're things for you to consider when you do not verify the death. So how you obtain your remote clinical support. During the GP practice hours, you should get remote clinical support. And then obviously out of hours, what's the service out of hours? And then outside core GP practice hours, remote clinical support should be carried out by clinicians working as part of the NHS 111 out of hours providers. So again, there may be ways of that. Equipment you're going to need. So when you do a death verification, you need to make sure that you've got your pen, your mobile phone with a video and camera and internet connection, lights. So that's obviously to do the pupils, PPE, bags, an electric heart reading thing, a stethoscope, and your lights. And again, your normal PPE stuff, which you guys know all about that because you've all done your infection control training. So, responsibilities of the person verifying the death. You need to understand the difference between expected or an unexpected death. You need to complete the necessary documents straight away and facilitate that accordingly. Inform the GP of the death and ask for remote support to verify the death, and inform the funeral directors and obviously let them know. And again, you have to inform them if there's a pacemaker as well. Recognition of death then. It is recognised that relatives of care home and others can recognise that death has occurred, and this will be documented at the time of the last observed breath. Okay, so we need to go back to when the last time we saw somebody breathing. This is not the official time of death. The official time of death is the time that the verification of the expected death took place. So the time you actually do your checks is the official time of death. Okay, so again, another benefit of doing this, you need to know when the last time their last breath was, because again, if you're on nights, maybe you do it. Do you normally do 2-hour walk arounds or hourly walk arounds on nights? What's the deal nowadays? 2 hours.
2 hourly.
So you go around, and normally on a night, are they in their room? Are they alive? That should be like the minimum check. And then obviously if they're incontinent,
If they're alive, if they're breathing.
yeah, good. So again, we should roughly be able to get this into a 2-hour window, shouldn't we? Nobody really should go beyond 2 hours. Okay, so quick recap then. So we'll ask some questions then. If you could just shout out the answers. Who can undertake a death verification?
A doctor or a registered professional?
Who else?
Someone with the support, but they're doing it remotely.
Yeah, so anyone, any care worker can do a verification as long as it's in the policy and they've been trained, and there's a link to remote support. What is an expected death?
End of life, we expecting it to happen, or the doctor is saying they are end of life, expecting in 1 week or 2.
Okay, what's the maximum time then? If they haven't been seen by a doctor, how much?
48 hours.
No,
20,
it's in days, isn't it?
28 days.
28 days, marvellous. What is an unexpected or sudden death?
where there was an accident or possibly a crime.
Perfect, thank you. Can care workers then verify death?
Yes.
Yeah, good. When should you recognise when not to verify a death? So when shouldn't you do it?
When is unexpected or sudden death.
Okay, that's one.
When we are not comfortable to do the verification.
Okay, good. Any more?
Or when the patient haven't been seen by the doctor or GP.
Good. So if they've not been seen within 28 days. Good.
Yeah.
Okay, marvellous. And again, if you just suspect that something's not right, then obviously you would report that. When would you obtain remote clinical support? So when would you call the GP to support you in doing the death verification?
Is it to give you instructions to verify?
Yeah, so it'll be straight away. So as soon as you suspect the death, you need to contact that remote clinical support. They'll come on camera and they will tell you what to do. And that's the next stage in which we're going to move on to. So the things that you do when somebody dies. And then finally, can you name 3 pieces of equipment that you'll need to verify somebody's death?
PPE.
PPE,
Yeah, PPE, good.
stethoscope,
Go, good.
obviously the eye check thing.
Good, the torch. So all of the equipment you've all been given. So you've got no excuses, you lot, because I've been around, seen you and given you your stethoscopes and torches, so you can all do this. Right, so before we move on to outcome 2, does anybody have any questions from outcome 1? All happy with that?
Yeah.
Yeah.
Marvellous. Okay, so learning outcome 2, this is what happens when you do the process. So this is the verifying the expected death. So this process assumes that the person or the relative has made and documented their decisions about their end-of-life care, chosen not to receive CPR if they've stopped breathing, and if there is no advanced care plans of DNA CPR in place. You'd obviously follow your agreed local processes and your organisation policies about what to do when somebody dies. So again, back to your policies. Once you've established to proceed with the verification, you need to gather the following. So the person's care plan, including their advanced decisions, so you know what their advanced decisions are, and a copy of the DNR, and also the notes and the paperwork. You need to do the identification of the deceased, especially in a care home setting. You need to ensure you have sufficient time to ensure compassionate and death verification. And if you were not present when the death occurred, ask someone to present the circumstances surrounding the death. So what led up to this and how are you, where you're at. If family and friends are present, obviously introduce yourself, ask who they are. It's important for the doctor. Offer your condolences. So I'm really sorry about this loss. Explain the need to confirm the death. You know, I'm here to verify the time and to ensure that they are deceased. Offer the opportunity for the family to wait outside the room. You know, if you'd like to go, my colleague will get you a cup of tea or something while we do this. And obviously ask the family if they have any concerns or questions. So again, what's useful is having some information for the family to confirm how you do death verification. Because again, if we go back to our fears about waking up in a mortuary, they're going to want to know why a doctor's not doing this. So again, you can have some information, you can take it from these policies and say, look, we are able to verify death. This isn't, you know, it's a basic skill, isn't it really? Spotting if somebody's alive or dead, not, you know, this isn't a good use of doctors' times. So when you are ready, you're going to call the GP or the healthcare professionals for remote video support. So straight away, you'll wash your hands and put on your PPE, and you'll enter the room of the persons and introduce yourself like you normally do. And actually, whenever I work with deceased, I carry on chatting to them as if they were here. I don't know what you lot do. Is that a similar thing you do? Do you carry on talking to the deceased? What does anyone do when they care for the deceased? There's no right or wrong answer here, by the way.
I think you look the way they died peacefully. They kind of it is easy to that they died like that.
Yeah.
Not without suffering.
Do you carry on talking to them when you're in the room? Do you carry on chatting to them?
Yes.
Yeah, I do as well.
But in a calm way.
Yeah. I think it's nice. I think it's nice to carry on talking to them. I once had a daughter, sorry, her mother had died, and she tapped me on the shoulder and she said, you know, she's dead, right? I was like, no, I know, but I'm just talking to her because it helps the process.
You'll be surprised how many times people have died and come back to life and said they could hear the person.
Yeah, exactly. So it's really important. It's really important. I just think we just carry on doing that. Obviously, confirm the identity of the person. So again, you need to confirm in your writing how you confirm their identity, because obviously they can't tell you. So did you do a video match? Did somebody confirm? You know, how did you do it? You need to look for obvious signs of life. So when we do basic first aid, what are signs of life? How do we know if somebody's breathing or not breathing?
Pulse.
Yeah, pulse.
Check the pulse.
Yeah, good. What else?
We can check the mouth.
Okay, so the mouth, the breath.
Yeah.
The skin.
So the skin basically goes pale, doesn't it? It just loses its color. What else happens to the skin?
It's like flash white.
Yeah, so it can go quite pale, can't it?
Yeah.
Equally, because there's no blood circulation, it's cold as well, isn't it? There's no blood warming it up. So
and
you
hot.
can tell quite quickly because the face kind of sinks in a bit, doesn't it? And if somebody's been dead for a while, the blood just sinks, doesn't it? So the back of the body and the legs goes purple. Have you all seen that? Yeah, because obviously there's no circulatory system.
No circulation.
Yeah, so basic signs of life. Touch them, are they warm? Look for the lips, rise and fall on the chest, basic check. So that's the first check. Try to ensure the person's laying flat. So if not, because obviously rigor mortis, we already spoke about this at the beginning. Get them into a position where it's respectful, okay, and dignified. Then what will happen? This is the legal bit. For at least 1 minute, you must feel the absence of the carotid pulse on the side of the person's neck with your fingers, with your index and middle fingers. So we're going to go here, and we have to check to ensure that there's no heartbeat for a minute. So you're going to need your watch and feel. Okay, so that's the first check, 1 minute. Okay, and again, don't be afraid to check both sides, and don't be afraid just to push in a little bit. Okay, and the reason why do we do the carotid artery?
There's a pulse, isn't it?
It is a pulse, but why that one and not that one? The one in the renal lung?
Because
I
you're not
think it's
necessarily
feeling
going to have as
better.
much pulse in the extremities than you are direct feed up to the heart.
Yeah, so we know that the carotid pulse is the strongest one in the body. It's the one closest to the heart. So actually, if you're going to feel it, you'll feel it there. Now, what I would do, some guidance says to do this. It's not in this guidance, but you can put on your ECG machines. If you've got an ECG machine, you could put on a blood pressure machine and inflate it, because that will pick up a heart rhythm. Or you could also put on a pulsometer. Because again, what you want is, you want to be 100% sure for that 1 minute there is no pulse. So I would put on an electronic device, whatever you've got in your homes. So I would feel, and I would put on an electronic device. And when I write my notes, I would go, I felt for 1 minute, and I also used, and whatever it is I use. So blood pressure machine, because a blood pressure machine picks up a heart rate, doesn't it? They normally pick up pulse. Your pulsometers pick up pulse. And obviously, if you've got an ECG machine, they pick up pulse. Yeah. Equally, you've got your stethoscope. So for 1 minute, you can do this and also put the stethoscope on the chest, because you really want to be sure that it's not, you know, there's not like a light rhythm or something going on. So you cover all bases on that one. But basically what the guidance says, for 1 minute, you're checking for a heart rhythm. Okay. Then you need to observe the person for 3 minutes for breath. Okay, so you're looking for the rise and fall. Now, ultimately, if you put the pulsometer on there, you're going to pick up oxygen levels, aren't you? Because the pulsometer will tell you what the oxygen is in the blood. So what would it come up at if they were dead?
0.
Yeah, exactly. 0. Wasn't a trick question. So again, we can put the pulsometer on, we can watch the rise and fall. The other thing that you may have seen is a mirror. So sometimes people have held mirrors over the breath, because if the mirror steams up, then there's breath coming out. So again, you're just looking for the rise and fall. You don't have to do that. It's not, it's just a thing. So again, pulsometer really good, and breath for 3 minutes. So you'll be observed remotely. So the doctor's watching you do this. These are the instructions the doctor's going to give you. Nothing there. If after 3 minutes you observe that they're not breathing and there's no response, squeeze the muscles between the neck and shoulders for pain. So again, you're going to squeeze there. Okay, so you're going to give them a squeeze, and you're going to try and see if their eyes flicker. Or the other one that you can do, run your fingers across the eyelashes. You can't do this to yourselves because obviously you won't twitch. But if you do this to somebody who's asleep, they'll flinch, they'll twitch. So again, really sensitive, little flick of the eyelashes or a pinch of the neck. Okay, so again, you're just checking for pain. Finally, then, you're going to dim the light in the room. You're going to get your torch, and obviously you'll shine the torch into the eyes. And then the eyes will just stay as they are. So the pupils won't dilate. Okay? Just as simple as that. So it's not a difficult procedure, is it, this one? It's relatively straightforward. It's pulse for a minute, breath for 3 minutes, and then after 3 minutes, you're going to pinch the neck or flick the eyes and put a torch in the eyes. And again, you can then wait 10 minutes and repeat that. Okay, so it's not a difficult process. And again, if you've got your stethoscope, you can listen for the heartbeat, and again, you can listen for the rise and fall of the chest. When nurses do death verification, we use a stethoscope. Because you're level 5s, you have a stethoscope, you know how to use them, you can check as well. Finally, the aftercare then, once you've established that there's no signs of life, you're going to leave all tubes, e.g. catheters, syringe pumps, pain patches, until the death is then verified. So that's by a medical practitioner, because you do the first bit. The doctor may say to you then you can remove stuff, but that's for the release of the actual cause of death part. And then ask the healthcare professionals whether you should remove any tubes, close the curtains, remove your PPE, and obviously wash your hands. And at that point, you're now ready for the aftercare of the body, because you have confirmed at this point there is no death. So some things for you to be mindful of. Sometimes in death, people may gasp. So that's a normal process, and that's just the lungs relaxing and the muscles retracting. Sometimes you may see reflex movements that occur. This can be upsetting. I have heard stories of people springing upright, from laying flat to springing forward. So again, it just depends what the muscles are doing, and people moving. And obviously that can be quite distressing for somebody to see, because they think they're still alive. And sometimes in death, the eyelids or mouth stay open. Try to close them gently. Sometimes a small towel rolled up underneath the jaw can help. So again, just shutting that jaw. And if you bring the eyelids down, you can do that. Finally, you're going to then complete your organisation's forms and checklists must be completed, and you'll record what you've done of the deceased persons in their care plan. So in the care plan itself, so if you use the electronic systems or paper systems, you're going to write the following. So this is what you must document in the care plan. The name of the deceased, the date and time, and this is the time that you verified it. The verification procedures, including each step of the examination and the results. So for example, you'll write carotid pulse check for 1 minute, no response. Breathing checked for 3 minutes, no breath identified. Pain check completed, no involuntary movement. And then repeated again. So again, whatever it is you've done, you will write down in the care plan what you did. Obviously the GP's been informed because they helped do the remote thing, and whether the next of kin's been informed. You'll write down who the funeral directors are and the funeral director's name and contact details. You'll write your name and role and the signature of the verifier. And then other people that were present. So who was there at the time when you did the death verification? And then anybody else involved in it, so the healthcare professionals, you would write down their roles, responsibilities, and if it was done remotely. So just a quick recap of learning outcome 2 before we have a short 10-minute break. Can you name 2 items that you need to gather before you do the death verification?
Stethoscope.
Yeah.
And a torch.
Okay, stethoscope and torch. Anybody else?
A pen.
Yeah, a pen. What documentation will you need?
The VOD form from the trust.
Okay, so you'll need the death verification forms, or you'll need their advanced care plans and decisions. Good. Name 1 thing you should do when you're ready.
Put PPE on.
Yeah, good. When you carry out the check, how long should you feel the pulse for?
1 minute.
1 minute.
Good. How long should you check breathing for?
3 minutes.
3 minutes.
Marvellous. Name 1 normal thing that could happen during the checks.
Moving.
They may move.
Moving.
Good. And then finally, name at least 5 things you should record on your care plan.
The name of the
Name, time,
The time,
Yeah, name and time.
Who was present?
He was present.
What checks have you done for
What
how long?
checks you've done. Good, one more.
the undertaker names.
The name of the funeral and the undertakers. Marvellous. Round of applause, everybody. Right. Shall we stop and have a 10-minute break? And then I will see you all back in 10 minutes.
Cool, sounds good.
Oh, I'm covering it up. Recording. Okay, so welcome back, everyone. Hopefully that 10 minutes was just enough to stretch your legs and grab some fluids. So this morning so far, we've looked at who can carry out death verification and then the process for verifying deaths. We're now going to move on to the aftercare bit, and this is the bit about the advanced cares and the next step forwards. So here we need to look at with the GP. I'm just going to mute you all there. Okay, so we need to record this with the GP, any necessary information, and about any process, the final care that was given of the deceased persons in preparation for their family and religious or spiritual practices. This should obviously be set out in the advanced care plans. If there is no advanced care plan in place, we need to obviously have a designated member of staff who will support the family with any support, and may also include contact with the GP for the collection of the death certificate. And that's to make funeral arrangements for the collection of the deceased prior to the funeral. So our process, the verification of death, just helps the GP formulate that death certificate to get that process rolling quicker. So it's really important that once we've done this, we forward on our findings to the GP. With the care of the deceased, you need to be prepared that in some instances, verification of death may occur several hours after the person has died, because the GP or nurse may not be able to provide remote support initially or immediately following a death. I'm hoping that's not the case. The whole point of this is that we speed things up. We need to ensure that the room is secure and maintained at a low temperature. So that's to ensure that the body is in a good condition for the undertakers and obviously for verification. You need to think about your infection prevention controls, and again, thinking about COVID-19, so they died of COVID-19, what does that look like within your home? So the processes for the aftercare there. And again, barrier nursing techniques should always be used. And then obviously, the verification of death process has occurred after the GP and clinician will provide the death certificate. A copy of this is then made available for the family so they can proceed with the arrangements. It's important that you then care for the family. So once we've done the verification and we've sorted out the person which we were looking after, it's important that the family can be supported during this time. And to provide them with the collection of the people's belongings and obviously all of that stuff. You need to inform that strict infection control measures are imposed. So obviously making sure that you've maintained all that. So again, this can be all sorted out prior to the death of somebody and in the advanced care plans. There may also be issues with following family members at the bedside. So again, thinking about isolations, thinking about who can and cannot attend, because obviously you've got your vulnerable people, and you may want a different area of the home. So if you have got people coming in during COVID-19, you've obviously got to think about your other vulnerable groups. So what will this look like there? Obviously, high-risk vulnerable groups, you need to ensure that they can acquire personal protective equipment. Again, in the advanced care plan, you need to record wishes and wants of the family members and any spiritual practices that need to follow. So, for example, do you need to call a priest, a rabbi, or anything else? and then make arrangements for the funeral providers. And again, I'll give you some links there. And your organisation may have a what to do after death guidance to pass on to the family members and the next of kin. And I don't know if you're all aware, but the government created a website called Tell Us Once. So basically, when somebody dies, you can put the death certificate number into this website called Tell Us Once, and it tells all the government departments that somebody has deceased. So again, it's a really useful thing. So you should have some information, advice and guidance of what to do after the death. So care for yourself and others, care for the other person who has died, obviously compassion all the way through, making sure that everyone's been informed and emotional support's available for people to deal with, and obviously dignity and compassion of the deceased throughout. Don't be afraid to ask for help or support if you're obviously struggling, and obviously speak to your line manager about things that you may have found particularly hard or difficult to deal with. It's important to be aware of your own limitations, especially in a crisis, and about involving the verification of a death. The well-being of support of those involved, and again, looking at the managers and being aware of limits. So again, just preparing some support around supervision, and obviously be prepared for that impact. It's one thing to look after somebody when they die. It's another thing to verify their death, because you are the person creating that closure. And again, you may end up with that constant cycle on your mind. Did I do it right? Did I miss anything? So it's really important that you've got an ability there to seek supervision and long-term support. And again, if you're feeling overwhelmed with it all, and I would say it's not that uncommon. So as a mental health nurse, I probably speak to 15, 20 healthcare professionals each week regarding end of life and death verification and the impact that it has on their mental health and well-being. So it's important that you can speak to somebody in your organisation and obviously outside. Provide the contact helplines and offer support, and obviously contact the helplines available in your local area or national resources. So again, I've given you those. So having a leaflet prepared for family members is really useful, because you can have all of this information, advice and guidance in a leaflet to explain to them about the steps of what to do when somebody dies, and then the phone numbers. Do any of your homes have a leaflet for people? Do you know?
Yeah, we've got a few.
You've got one. Well, what about Victoria Lodge or Claire or Clara? Do you have any?
We haven't got, no, haven't.
You haven't got anything. What about Victoria Lodge? Do you have anything? You're on mute, my darling. Dory, you're on mute. There we go.
Sorry, what's again?
So do you have a leaflet to help with managing things after somebody's died? So like
No.
phone numbers and stuff. Okay. So on here, when I email this out, it would be useful for you to go back to your managers and say, look, actually, in our training, the aftercare bit is really important, because what do you think family members will remember from your service when somebody dies? What bit do you think they're going to remember? When you've looked after their mum or their dad and their mum and dad's passed, what do you think is going to be important to them?
It's the kindness and the way we treat the residents.
Yeah, the residents. But what about them? Because we're all selfish human beings at the end of the day. We all want something about us.
When we are very kind and kind of supportive to the family and to the residents.
Absolutely. So you could be the best carers in the world, provide the best care, but actually, because you've not done this aftercare bit and because you've not closed that circle, they may feel unloved. So they may feel, oh, I've just lost my mum and you just kind of kicked me out and it's a business. So having somebody just to talk to them about, look, we're really sorry that your mum's passed away. Here's some advice on what's going to happen now. And look, we've prepared a leaflet for you. Here's some support line numbers for you to talk to for afterwards. And it just shows that you're still caring for the living and you're caring for the family members. So that small act of kindness will give better customer service in the long run. So just a quick recap on that section.
Can I just interject and just add to that? So certainly when we give the leaflets that we have, it really, obviously a lot of what you're saying at the time, obviously no disrespect to us as care workers, but they're obviously in a state of shock, and often they're not in a position where they can listen to a great deal of what you're saying. Obviously having that takeaway, obviously when they kind of get in a state where they are able to start taking in information, and then obviously having that immediately available has been incredibly helpful for them.
Yeah, absolutely. And it is about the aftercare bit. It really is, because ultimately, I think the way that they see it, if you care for them, you're going to care for their loved ones even past that bit. So it helps manage that anxiety that people feel. And just having a leaflet prepared and providing them a named person in the organisation that they can talk to, because again, it is really time consuming managing family members. So having a named person in your service that they could come and talk to afterwards about their feelings is kind of really important. So recap on section 3 then. Name one thing to do with caring for the deceased. So what can you all name one thing?
Hold hands.
Okay, so you can hold their hands. Okay, that's one thing. Yeah, next.
Talk to them.
Talk to them. Yeah, to be comforting, reassuring. What else could we do? What was the first thing the information said? If they're sitting upright, what could we do?
Make them comfortable in a bed, for example.
Lie them down, make them comfortable, rigor mortis and things like that. Good. Name one thing you can do to care for the family.
Emotional support.
You can give emotional support. What else could we give them or do for them?
Leaflet with the numbers.
Yeah, so some advice and guidance, some follow-on stuff. Good. And then name one thing you can do for yourself or for your carers. So what can you do for yourself or for your carers?
Get support if you feel you need it.
Okay, so get support for yourself if you feel you need it. The one thing that I would say there is get support or talk even if you don't think you need it. Our brain stores negative stuff. It just stores it. And actually by talking, we bring it to the conscious level and we can bat it away. If we don't talk and we hold it in, our brain is like a cooking pot. It just fills up and up and up and then explodes. So it's always good, even if you don't think you need to, talk, you know, and if you need to deflect some stuff off your chest, that's what it's for, because I am surprised the amount of carers that I see on a daily basis in my nurse as a clinical practice nurse, a GP setting. I'm surprised how many carers I see with mental health because they've dealt with somebody who's passed away and it's just triggered too much stuff for them. So it's really important to do that. Okay, so these slides just look at some additional stuff for wellbeing and support. So here you've got a link there, and that's for government guidance and skills for care, and there's some support tools there. So if you're a manager of a service, you can click on that link and it takes you to some stuff. It's important that you offer bereavement and trauma lines, because again, we become desensitized in our jobs, okay? And the reason we become desensitized is because if we didn't, we'd be a puddle on the floor. You know, every time you have managed a loss of life, you've probably had a tear, you've probably had to go away, but ultimately you have to compose yourself for the family, don't you? And it looks like we're insensitive, but actually it's not. It's just our coping mechanism to get through the trauma. The problem is trauma builds up and eventually it comes and gets you. So it's important that you've got phone numbers there to deal with it. Wellbeing and support resources. So the British Psychology Society set up a support group. Again, there's some phone numbers there and some links for you to go through, and Samaritans to help with stress and anxiety. The other one there is a website called Silver Cloud Health. And Silver Cloud Health looks at bouncing back, and it looks at things about promoting your own well-being and coping skills and sleep. So again, Silver Cloud Health is it's a really good resource for carers. The the Workforce Care app that was developed, in there you've got lots of other things, and there's also your blue light card in there. Sleepido is a really good one if you're struggling with sleep. So there's lots of things in the Workforce and the Adult Social Care app that you log into, and in that app it's got loads of stuff in there for carers. It's got mindfulness, it's got supervision, there's some training stuff, there's your discount cards, there's learning materials. So you should all be downloading your Care Workforce app. And in there, it's got everything. It's got policies, it's got procedures, it's got your rights as a care worker. So, and it's free. So you can download the government's Workforce Care app. And equally, I think it's got things in there as well as parking areas that you can park as a carer and lots of other things. So it's
50% off Domino's.
Sorry, Andy?
Don't forget 50% off Domino's.
Oh yeah, and discounts on Domino's pizza. Only Andy would say that because he likes his Domino's. I think it's called cheese and bread, actually. So again, there, definitely worthwhile doing. Advanced care planning. So this is a quick guide for registered managers. And here you've got the nice guidance. So that's the National Institute Care of Excellence surrounding kind of how to prepare end of life. And then finally here for the Skills for Care site, you've got the learning resources and tools directly from Skills for Care. So again, some stuff there to have a look at. And digital technology, there's another little link there for about some other resources for you to have a look at. So references, because obviously we're evidence-based practitioners, this training has come from 4 key sources of areas. It's come from the British Medical Association, and that's about the verification of an expected death. So it was written in London. You've got then the government's view on the verification of death in the communities and verifying deaths in a timely manner in an emergency. So that's the law changes that happened. So you're going to need this. If you're going to review your policies, you're going to need these links. Verification and confirmation of death. So if you're in a nursing home, this is the RGN's, the Royal College of Nursing guidance for verifying death. And then you know how I said there's a flow chart, create a flow chart. Here, the British Medical Association created a flow chart. So there's a flow chart there for you to follow for death verification. Finally, other things to consider then is around your faith groups. So there is a link here for faith at end of life. So that looks at different religions and how soon you need to do things. You've got a special edition of Care After Death and this is for registered nurses with the hospice. So there's some more links there. And obviously the respect process, and that's just a summary of all of the processes around end of life care. So again, some other bits there for you to have a look at. So in this session, and I'm going to show you the paperwork and policies after this. In this session then, we've looked at learning outcome 1, understanding information for individuals and employers. Do you feel that you've got a good understanding now about verification of death? Yeah, good.
Yeah.
Learning outcome 2 were things to consider to plan and prepare. So that's getting your equipment and documentation ready. Learning outcome 3 was what happens. So that's carrying out the task. And learning outcome 4 was the aftercare bit. So making sure you've got the aftercare of the body, the aftercare for the family, and the aftercare for your staff. Does anybody have any questions so far? And again, I've either done an amazing job describing everything to you, or I've baffled you all into silence. Okay, so what I'm going to show you now then is the documents in which I'm going to send out. So alongside this, you've got 2 documents that I'm going to give you. So this one is developed by Skills for Care. So we know Skills for Care is our sector skill council, and this is going to look very familiar because actually this is what I've based the training off of today. And it just goes through. So if you want the guidance to give to your managers, this is the guidance with all the links and all the stuff there. So that's what we've done today. And then the second one, if you're looking for a bit more policies and procedures and something to review in your homes, I found this one. So obviously it's from the NHS, but I have to say they normally do the best policies.
Thank you.
And then down here, as we go through, it looks at the verification death policy. So it gives you a summary. And then it gives you all of the training, which we've just done. And then at the back, it gives you the forms. Okay. So if we go down to the back, and we'll just have a look at this paperwork. So again, if you don't have paperwork up in your place of work, you can have a look at this and it will be really useful. So here you've got Appendix 1, which looks at reportable deaths. And there it just looks at the things, deaths must be reported to the coroner by a medical practitioner or the police in the following circumstances. So that's really useful for you, that first one. So again, if you don't know, was it natural causes? I'm just going to pause that again. Because you're, if it's not been attended and it was extended for 28 days, you just keep an eye on that. That doesn't go back to 14 due to COVID. Again, history of suspicious things. If it's linked to an accident, neglect, an illness that was undetectable. So again, you've got those there. So that's a really useful appendix. Appendix 2 is the nurse's verification form of an expected death. So again, you may want to change this form for your place of work. And you can see here, it's got all of that stuff that we talked about. So painful stimuli, pulse for 1 minute, heartbeat. So on here it says 1, but you'll do 3. Respiratory movements and sounds and breaths, fine. And then the pupils and lights. So again, you're just going to sign that to say that you've done that. So this form is a relatively straightforward form, and that would be for the nurses or people to complete. If they've got a syringe drive, so you could fill that in for a syringe drive. Here you've got the competency frameworks. So again, you can use this if you're going to do a training session for staff. You can sign this off as your competency. So this is the OSCE, if you like, the competency sheet. And we'll talk about that because you're all going to be doing something for me after this. But here you can see you're working with your own scope, you've documented it, you know what the potential cause was, you've checked the pulse, you've used the stethoscope, listened for the heartbeat, you've listened for the breath, you've examined the response of pupil to light, you've looked at painful stimuli, and then you've documented. Okay, so that's the sign-off sheet that basically says you can do death verification. And here, there's some questions. So at the back here, we're going to talk about that in a second because that's going to be your homework. And there, you've just got some further reading. And at the back, that you don't need to worry about that. That's the quality impact stuff. Suggested tools for verification for death. So that's just another form here for you to do an audit around death verification. So let's just go back to the top there. So I'm going to email this out to you all. So you've got a copy of that. well, actually, I'll put it in Canvas. So you'll have a copy of that in Canvas, today's video, and then the PowerPoint. Now, if you can all pop your video cameras back on, or your cameras, microphones, so you can speak. That's just lovely. Let's just close my screens down. Bear with me, I'm just bringing up my screen sharing. Yeah, I'm trying to be clever, but it's not working. Okay, I don't know why that's not working. Never mind. I'm trying to turn my screen share off. But it doesn't want to work for some reason. Okay, never mind. Okay, so just so you're aware for your homework for this, oh, that's better. What I'm going to ask you to do is to be signed off. I want you to do a video and some role play. So you need to do a death verification process. You can either do it on a loved one or a dummy, depending on how many dummies you have lying around your places. But I just want you to go through the process of doing the death verification. So that checklist sheet, you just need to go through it, and you'll just record yourself doing a remote death verification, and then you're going to video that, and then you'll email me that video. Okay, so all I want to see is you going through the checklist of verifying somebody's death. So a minute for the pulse, 3 minutes for the rise and fall for the breathing, the pain stuff, and then a review, and then the recap and the write-up. Okay, so that's what I want. If you don't do the write-up, that's fine. You can verbalize it and say, this is what I would write in my document. Okay, and then once I've got that video, I can sign you off and issue you your death verification certificates. Any questions? Does that all seem relatively straightforward? He says.
Mm-hmm. Yeah.
I mean, ultimately, it's a practical skill. You know, I just need to make sure that you can approach somebody with dignity, talk to them, and just say, I'm going to do a death verification for you. The form that I've got, you can download again from any website. You can do a death verification form. They're all going to say the same thing. It's going to be, have you checked the pulse? Have you checked the breathing? Have you done pain stimuli? And you just sign it off. Okay, you don't need to do it in a nursing home setting. If you want to just do it at home on a partner, feel free. Or you could do it on a teddy bear.
On my dog.
You could do it on the dog if you want to do it on a dog. I don't mind. Ultimately, the person's going to pretend to be dead anyway. So it's not like they need to be the world's best actor. But it's just to make sure that we can go through that process, and that I know if you needed to verify somebody's death, that you would be making the right decisions. Okay, throughout today's session anyway, you've answered all the questions, so I don't have a problem with that. Does anybody have any questions for me? No, it's quite a straightforward topic really, isn't it? It's really the last part of what we do in nursing. It's just that final bit. And obviously we just want to make sure that if we do death verification, we do it correctly, because we do not want them waking up in a mortuary. I couldn't think of anything worse. So if you haven't got any questions, I will see you all shortly. Again, August, September time, I'm going to be coming out seeing you all for the second round of observations. Okay, so I'll be booking that in with you all shortly. So once I've got this video back, do your death verification video. You can WhatsApp it to me or just email it to me, and then I can sign you off for death verification, and I will see you all in August, September time. Okay?
Yeah.
All right. Take care, everyone. Bye.
Bye.
Goodbye.
Bye-bye.